Hi, my name is Krisalida Ferreras, and today I'm presenting my research study called Burnout Syndrome in Clinical Cycle Students of Dentistry degree at Universidad Nacional Pedro Henríquez, Ureña. Burnout syndrome is known as an inappropriate way to manage chronic workplace stress, informed by negative behaviors and emotions. This is also present in the academic field, being considered as a prolonged disorder, which is characterized by both physical and mental fatigue. Burnout syndrome addresses three scales: exhaustion, cynicism, and professional efficacy. The general objective of this research was to determine the prevalence of burnout syndrome in clinical cycle students of dentistry degree at Universidad Nacional Pedro Henríquez Ureña. There also were specific objectives, such as determine the knowledge about burnout syndrome, analyze if there exists a significant relation between burnout syndrome and clinical cycle level, identify the sex that presents the burnout syndrome more frequently, and establish the most frequent level of burnout syndrome among clinical cycle students. 88 students were survived using Much Like Burnout Inventory student survey template via Google Form, resulting in 89.7% of the students suffering from burnout syndrome. 38.6% of the students knew the syndrome. 76.9% of the male students and 92% of the female students suffered from burnout syndrome. 18.1% of the students with a low level, 57.9% with a medium level, and 13.6% with a high level of burnout syndrome. In conclusion, a high percentage of these students suffered from burnout syndrome. Most of the survived students did not know the syndrome. The higher the clinical cycle, the more cases of burnout syndromes there may be. Instead, the level of the clinical cycle does not influence the increase of the level of burnout syndrome. Feminine students were the most affected, and the most frequent level of burnout syndrome was level mid.